Hello and welcome back to the Heart to Heart podcast series from RehabCare. I'm Jennifer Platt, Senior Director of Learning and Organizational Excellence with RehabCare. Our podcast is a bi-weekly exploration of the hearts and minds of everyday healthcare, therapy, and wellness workers. In each episode, we're talking to a different RehabCare employee who works in the trenches of physical, occupational, or speech therapy, or in our wellness program. We'll learn more about them, their jobs, and how that job unfolds in a healthcare facility. We'll also get words of wisdom on what inspires them the most about the facilities they work in. We think you'll be inspired too. So let's talk heart to heart with Megan Reese. Today's guest is Megan Reese, a member of the RehabCare team who serves as an occupational therapist with Johnson Mathers in Carlisle, Kentucky. We're going to spend the next few minutes talking heart to heart with Megan on the best part of her role. Megan, thanks so much for being here.
It's an honor to be here.
Megan, tell us a little bit about what you do as an occupational therapist at Johnson Mathers.
Sure thing. As an occupational therapist working in a skilled nursing facility, roles really vary depending on their patient, their diagnosis, and what their discharge plans may be. My role as an occupational therapist at Johnson Mathers is to improve or adapt our patients' ability to do the things that are meaningful to them through therapeutic use of everyday activities. It's my job to conduct individualized evaluations that are specific to each patient's goals and then develop a customizable treatment plan to allow patients to perform and achieve goals to reach their maximum potential.
And do you manage anyone?
I'm also responsible for supervising a CODA in which I ensure each and every patient's plan of care is being followed. I'm able to collaborate to discuss any concerns or possible adjustments that need to be made to the patient's care plan so they can progress with their goals.
That's great, Megan. I can tell you're passionate about what you do. What is the best part of your role with Johnson Mathers?
The best part of being an OT is not only seeing a patient progress, but also being a direct part of their progress. One of the best feelings in the world is seeing a patient progress towards their own personal goals and seeing the look on their face when they achieve something they've been working so hard for. I love coming to work knowing I can make even just a little difference in someone's life. It brings such a joy to me when former patients call or come back in to see us after they've been discharged, and knowing they're back at their homes and doing what they set out to do when they first started therapy.
That's really inspiring. It sounds like your patients are almost like personal friends or even family to you. Are there any patients in particular who stand out for you?
Yeah, one particular patient that comes to my mind is one of my first ever patients as an OT. It was a gentleman who had suffered from a CVA resulting in significant hemiparesis on the right upper extremity. Being a new grad in this field, at the time, treating a stroke could be very intimidating. But I was very determined, and I remember going home every night and researching and studying to ensure I was able to provide the best possible care for him. In my area, farming is very common for our patients. My patient came to the skilled nursing facility for rehab services, and he was very independent and still an active farmer prior to the CVA. He was determined to regain functional use of his right arm and hand, and it was a joy to watch him progress each and every day. I don't know who was more excited the first time he was able to use his right hand to assist with buttoning his shirt, him or me. He worked so hard, and he was able to return home with his wife with good functional use of his right arm and hand. He went home with home health for continuation of care, and he has stopped in several times to visit. He is doing great, and I love to hear his stories that he's continuing to do his farm work.
That's amazing and so inspirational. I can see why you love what you do. I want to ask your thoughts on how RehabCare has helped you prepare for your role as an OT.
What I like most about working for RehabCare is the support I receive when using my clinical reasoning to make decisions regarding my patients. I feel like I have a great support team with upper management, and they're always willing to assist and listen to concerns that may come up. RehabCare also provides excellent support and resources to grow as a better clinician. They provide us endless resources and programs that help us grow as a therapist in multiple areas, including patient care, documentation, and tools that help us assess and evaluate our patients to the best of our abilities.
Megan, that's wonderful. Thank you for talking heart to heart with us today. You've convinced me that when you love what you do, combined with having a heartfelt relationship with your patients, you can achieve the best results and help them reach their personal goals. Thank you for what you do every day on behalf of RehabCare and Johnson Mathers. With that, we'll bring today's discussion to a close. Join us next time as we continue our Heart to Heart series with the dedicated team at RehabCare. Thanks for joining us.